Mm-hmm.
My bad. I wait, man. I was like, oh shit.
You're supposed to set an alarm.
It's been a long
Supposed
day.
to set
It's been
an
a long day.
alarm. That's what
You right.
I have to put everything in my
You
calendar.
right. I know. I'll be tripping. My bad. My bad. Little late to give people this free ass information. My bad. Damn, that will go off right now. Hmm.
All
All right, let's get
right.
to it. Oh damn, I need to change this
Um, so
because not having this light is
one
gonna bug
second.
my
Let
soul.
me see. So I'm doing it from a different phone, so I don't know. No, that's what I'm trying to do. Um,
All right.
trying to see where's when I
You got
definitely have
questions?
submissions,
You
but
have
I was
questions
trying
for?
to see like I don't have the bubble on my screen like I normally do, so I can record questions.
Uh, if somebody could kick off a question, I could just stop running my mouth. So I had listen. Let me tell you about this
Okay.
damn one patient,
Story
right?
time.
Let me tell you black people something. Let me tell you black people something. I'm just gonna get this on out there. I was gonna do a post about it, but people take it the wrong way. So I just do it with, family who y'all follow me and y'all understand. So again, if I can't say, and I don't say this by trying to brag, or I don't say this by trying to like throw it in people's face, but please believe there are many more things that I could do with my time other than the surgeries and stuff that I perform. I swear to God, I genuinely do it because it is my calling to just eradicate healthcare disparities, and I genuinely want to help black women in particular. I want to help all women, but my sisters in particular, which is why I do this stuff. And when I tell you for what I do, you have no ideas because I work at underserved, underprivileged hospitals or whatever. There are no resources. The ancillary staff and is doing the best that they can. But I'm doing a lot of stuff above and beyond. Calling insurance is doing a lot of stuff that I have no business doing, that I will never get paid for, that I will never see, just to get reimbursed like peanuts, just to help people. With that being said, I do it. I don't care about that as long as I'm helping people and they're appreciative. Fast forward. So, like y'all know, like people call me from out of state and to set up these surgeries or whatever. So, lady called me from an unknown state and had a consultation, yada yada. I was like, cool, set up surgery. So I set up for surgery day in March. March comes, like, now I'm relying on the hospital to call her or whatever to tell her, your surgery is set up. My bad. They told her like a week or two before her surgery, which was like totally inappropriate. I took the blame for that. I was like, you got notified late. I'm really working with the staff to let them understand that, I have patients that are coming from out of state. That like there needs to be advance notice. At least tell my office so we can tell them. Took total blamed for it. And it's like, look, I'm gonna get you back on. Let me know when you can get on. Like the next time I have available is in May. Like put you on in May or what have you. We'll set it up like that. This was in February. My office manager does her due diligence or whatever, calls her or has a conversation with her, last week. This is 6, 7 weeks before surgery. She goes off the hinges. Nobody authorized my surgery before you scheduled it. I got a life. I got to do this. Da, da, da. 7 weeks before surgery. So she hits me on a DM, and I'm just like, listen, I mean, it's 6 weeks before your surgery. Like, what do you like? No, this is not how it goes. Like, you're supposed to ask me if this date is available. But I'm like, number one, what do you think I do? Number two, like, how do you think this goes? Like, surgery is like, it's not like, oh, you get to just pick this up. It's like so many things for you guys, like just behind the curtain, have to happen for surgeries to actually happen. And I'll tell you at least five. Number one, you have to have the surgeon's availability. If I can't talk to people in the office, if I can't, do other things to actually even have an OR time, I can't even have an OR time. That's number one. So my schedule is extremely important to be able to have the time to operate on you. Number two, the actual hospital has to have time, right? I'm not the only surgeon on earth. There are general surgeons, there are bariatric surgeons, there's plastic surgeons, there's GI doctors. There are all type of surgeons that are vying for certain spots. I've had to fight for my own particular time, which is only a day of time in this one particular hospital to do these surgeries, which is my time. I can't infringe upon all of the times. I have my days that they give me called block time, right? That's number two. Number three, you got to have the staffing for it. So that means just because you have it that day, like people get, you have low volume time, people are not available, nurses are not available, ancillary staffs, whatever, you have to have that particular time. Number four, you got to have your insurance, right? So even after all of that, if you have a date, like the insurance has to approve it, the insurance has to approve not only the surgery and the surgery that's being done, they also have to approve how many days you're staying in the hospital. Is an outpatient surgery? Was the documentation correct to justify the surgery that you're getting or what have you? Like that has to be approved. And then after all of that's because all of that's set up, and then your preoperative testing, all of that stuff has to be done to make sure that there's the things that are set up in place for you to make sure that you can transition and get into surgery. So all those things have to
And line
hit
up.
before you get into surgery. And all it has to line up. So before you fit, like, I swear to God, like I work with people, I don't have a problem. Like I understand things happen or whatever. But the worst thing that you possibly can do to make me mad or aggravate me or any surgeon for that matter is to call and be like, I can't do this and cancel your surgery or complain about like surgical dates, because there are really people that are out here that would give like one of their limbs to have like a date, right? I got women that are like 3-4 months out that will just say, please, if anybody cancels, anybody sneezed the wrong way, just put me in that position. And for you to be so cavalier and just to take that, this time frame and just say whatever, it burns me to no end. So I've had patients that have canceled for legitimate reasons, house caught on fire, like if you have that, not a problem. Like life happened, life be lifing. I get it, not a big issue. But if you just do not realize how serious and how much people have to sacrifice and how many things have to happen for you to have your surgery, and you're totally not only unappreciative, but like cursing out staff and acting a damn fool because things don't go exactly the way you think that you're going, please miss me. That's when my niceness and nice Dr. P trying to help people go out the window. Yeah, like I don't appreciate ungratefulness. I don't need anybody to kiss my ass or give me a bed of roses or sing high praises. Just don't be ungrateful. That's my biggest thing. But that's my thing. I want to do a post about it, but like people get all upset or whatever. But that burns me to no end
I
when people do that.
no, I totally
I'm done.
understand. That's a good share, because I don't think people understand everything that coordinates on the back end and how
Have
many
no idea.
calls and how much phone tag people play just to coordinate one thing. So no, I understand, but I know everybody don't understand that back end. So sometimes it does help to understand how things communicate together. All right, so welcome everybody.
Yes.
Yeah, said Dr. P, you convinced me with that drama. Thank you for joining.
Yes,
If you
yes,
want to
man.
join the live, you're more than welcome to send a request to join to be part of the live. We're continuing our free game. And it's like you get a free consultation on the spot. I do have plenty of questions that people have been submitting. And I definitely normally would ask you all to put.
Hey, hold on. Hey, Dr. Daryl. Hey, man, I sent you a WhatsApp. See, these my brothers, and Dr. Daryl is he is a gynecologist, OBGYN in Jamaica. So I got two high volume docs in Jamaica. I'm trying to get down there and operate. We've been talking about collaborating and doing stuff. Hey man, you got a tool that you use? I'll send you a message. I need a little information on that, man. Check your WhatsApp. My bad. Go ahead. He don't check. He got like an automated thing when I DM him or whatever. So I had to WhatsApp him, but he's so busy, like he didn't see it. But I'm
Are
sorry,
you
stop that. My bad.
good?
Go ahead. Keep going.
Um, well, oh, I have questions submitted. Definitely people have submitted things that they want asked. Normally I would ask you to drop it in the chat with the question mark, but I can't see that today. Only probably P will be able to see it. So usually since I manage that, you can put them on the screen. I'll try to get the ones that I can as I can scroll and scroll back and forth. I'm gonna start with,
Somebody asked me if I needed a scribe. Oh, absolutely. I wish I could, but we poor over there, mama. If I could pay for a scribe or what have you, I sure would. But I definitely didn't get my hospital to pay for it. Like it would make things so much more efficient. But yeah, scribes would be so helpful. But if I had the resources to have one,
could you define
I
what
would
a
do it. But
scribe is?
my bad. That was the question. So a scribe is so like for like they expect us to do everything like as a physician, um a surgeon. We got to do the surgery, do all of the notes. Like anytime we're talking to you, we have to document all of those things. So all of those risks and benefits, your history, present illness, your family history, physical exam, all that stuff we have to document in the computer. Then we have to write all of the notes from the hospital. You have to do an operative report. You have to do pre-op stuff. You have to do like so much stuff like before surgery, during surgery, after surgery, or whatever. So a scribe actually like as I'm talking to patients or whatever, like inputting it into the computer. Because I can't while I'm in the room with like if I was in the room in there with you and I'm just like, oh yeah, doing like this or whatever, you'd say like,
Mm-hmm.
what the hell are you doing? It's not listening to me. But so I have to pay attention, listen to everything you're saying, remember all of this stuff that you're saying, and then my bad. And then going at the end of the day, go and jot it, put it in all of it in the computer, which takes so much time. It's just administrative stuff. That's the administrative side of medicine. It's just like, oh my God, it's the worst. So just having somebody to just input that, which I do have, I'm not gonna lie. Like at my new hospital, I have residents. It's a give take. They learn from me. I teach them. They help me do all of these orders and stuff like that. That's at Mount Sinai. But at Ingles, I am the resident. I'm the resident. I'm the nurse. I'm the doctor. Like I got to do it all. So it's like it's very painful. I gotta plug
All
my phone
right.
now.
All right. So first question of the night. Is it possible for fibroids to return after a hysterectomy?
No, plain and simple. Fibroids grow on a uterus. Once you remove the uterus, you remove the fibroids. Fibroids have nothing else to grow on. So no, you won't have fibroids if you do a hysterectomy. No.
All right. Next question. Can you suppress endometriosis with Lupron?
Yes. So Lupron is a medication, just to break it down for you guys, is a medication that is also is a hormone suppressant. So any medication that you have from a GYN perspective, it's looking to stop the production of hormones from the ovary. Some like birth control pills work at pretty much at the site of the ovary. Some higher medications like Lupron work at the level of the brain, right? So it just depends on where the medication is working on how strong it is. So Lupron is a medication that works at the level of the brain to basically suffocate the ovaries. Endometriosis is fed by ovarian hormones, estrogen, progesterone. So once you give Lupron, it's stopping the ovaries from producing that hormone. Thus, the lesions of endometriosis are not fed anymore, which makes the pain better, which makes the bleeding, all of the symptoms associated with endometriosis better. The problem with Lupron is it's a temporary medication because it puts a stress on your bones. So your bones for women are dependent on estrogen for growth and health, right? So Lupron is a medication that suffocates the estrogen production, which then kind of um, uh, just slowly or temporarily stops bone development and growth. So if you use Lupron for way too long, you increase the risk of, osteoporosis, bone disease. You can increase the incidence of heart disease if you use it for way too long. So that's why 12 months, max 18 months is all you can use Lupron. So Lupron is a very effective medication, but it's a temporary medication. You have to have a long-term plan after Lupron.
All right. How long do you have to wait to get pregnant or try after a myomectomy?
6 months. That's the guideline standard. So if you're removing a fibroid out of the uterus, the recommended wait time is 6 months of healing. That's what I recommend to my patients. If you can wait longer than that, um, that would be great. Because again, it's like almost like blowing out your knee and then going to try to play basketball in a couple weeks. You have to really allow the knee to heal, rehab, and then get ready to get to that point. Right. Same way with a myomectomy. You're removing the fibroid out of the uterus and expecting that space that has been closed up on the uterus to heal appropriately. So that takes time. So usually about 6 months minimum.
Can you shrink fibroids without having surgery?
This is the question I just got. To some girl just continue. I refuse to argue with this young lady. I mean, I call her a girl and be respectful, but I refuse to argue with this woman again because she went back to one of my old posts, and again, from me, out of my mouth, I am a doctor. I am also a health nut, right? So I believe in eating healthy. I believe in, decreasing processed foods. I am even myself have stopped eating a lot of meats. I've tried to cut back a lot. I'm not a vegan, but I'm doing, as much or close to veganism as I possibly can. I get it. Herb supplements, those are the keys to healthy living, right? So I encourage them. I want people to do them, to do that, incorporate that lifestyle. I encourage it to my patients all the time, but don't get it twisted. Just because you're healthy and you eat healthy does not mean that's going to equate to fibroid treatment or fibroid treatment. You come here, boy. Come on. I love black women. Come look at my son. Look at. I'm teaching the boy right. Come
Oh,
on.
yeah.
Look at it.
That's what's up.
Look at that.
I love that.
See that?
I love
Show
that.
your face. Say hi to the people, boy.
What's up, man?
So, but yeah, so doing these things gives you the belief that fibroids come from food, and they don't, right? So I operate on vegans, I operate on vegetarians, I operate on health experts, I operate on all of these women that are extremely healthy with fibroids. So me telling you that some type of diet or some type of exercise or something that you're doing is causing this to happen would mean that if you eliminate this, then it's going to make it better. It's false. It's wrong. I could tell you, like, somebody got into my DMs just arguing about, like, they sent me, like, I don't go on anybody's page, like, arguing with them. Like, if you're giving misinformation, I'm not just gonna, I don't have time to hop on people's pages and tell them, like, you're wrong or whatever. If people are believing it, them do have like 300 and some odd thousand followers or what have you. I got 18,000, right? I've been at school, experience, do this on a regular. They're going to listen to him for whatever reason. But if you send me something where I know somebody is giving misinformation, who has no knowledge, has never held a fibroid in their life, couldn't even pick a fibroid out of lineup if you gave it to them, and you're going to listen to them about the herbs they're selling, the diet that they can manufacture to create or to shrink your fibroids, use your common sense. The answer to that is no. Now, with that being said, with the question of can you shrink fibroids? Yes. If you take Lupron, your fibroids will shrink in size. The problem is it's temporary. right? Once you get off Lupron, they're going to come right back. They're going to go right back to their regular size, right? Birth control or any other of the hormone suppressants don't really shrink fibroids. And also, too, people are like, oh, we'll just get to menopause. You may
No.
lose some volume in them, but they're still going to be persistent. So there's really nothing that I can give you that's going to be a magic pill, magic cure for fibroids. People don't want to hear that. People think that it's BS. People think that it's just like me trying to just operate on people, whatever. Trust me, if there are other surgeries I do perform, it's not just for fibroids, it's other surgeries I do perform. So don't think that I am holding back information or there's some magic antidote that I'm just not giving people that's going to shrink fibroids. It's just not. It's not. It's nothing safe. It's nothing that's healthy or nothing that's sustainable that's going to significantly decrease the size or shrink your fibroids. It just isn't. And if somebody, again, there are medications that have a lot of side effects that do shrink them, but you have to, they're only for temporary use. I'm on the live. You want to say hello? So let's see
Hello,
my show.
everybody.
You can hit your toe now. So all these
Yeah, I
people see.
did. Hey, everybody. Oh, I look a hot mess.
Well, you on the live looking at a hot mess. Watch out, child.
Mm.
But anyway, no, there's not. I got you. It's in my car. Go get it. Go get it. It's in the car. I got it. But yeah, it's nothing in the Tesla. But yeah, there's nothing there that is going to just do that, hands down. No. So if anybody wants to talk, yeah, oh well, what about Lupron? I'm telling you, yes, it does. You're not hearing me say that it doesn't. It's that one, is it sustainable? Two, does it have side effects? Three, is it a cure? It's not. None of those things. It's all temporary stuff, and you're looking for cures and fixes, right? You're looking for things that are going to enhance your fertility. You can't get pregnant on Lupron, right? So if your goal is to get rid of your fibroids and have babies, guess what? Yeah, your fibroids will get smaller a little bit on Lupron, but once you get off and you try to get pregnant, it's gonna come right back. So that's the answer to
How
that.
soon after an open myomectomy can you begin doing physical fitness such as strength training?
So what I tell patients, and everybody has their own philosophies, and it depends on how the surgery is done. My open myomectomies are with really smaller incisions, so I'm much more judicious as far as like when my patients can get back. But in truth, if you have a large incision, um, and you really want to give it 6 weeks, I tell my patients no real strenuous strain or on that incision for at least 4 weeks, but 4 to 6 weeks, honestly. But with that being said, you still can get on ellipticals, be very active, but it also, again, it depends on how it was done. If you have a vertical incision, nah, scratch that. It's going to be every bit of 6 weeks or longer than that. If it's a small horizontal incision, it's going to decrease that risk, which is why I'm a proponent of minimizing incisions and scars so you can get back to your normal routine.
How do you decide to remove fibroids through laparoscopic surgery versus an open myomectomy?
So, and this goes back to and I'm gonna say it again because I was just doing this live with my patient last week. And I'm gonna say it. I'm gonna say it. I said it before. I'm gonna say it again. I want people to save this, share it. I no longer endorse robotic or laparoscopic myomectomies. And I'll tell you why. Again, robotics, laparoscopic surgery, all of the above. I believe in robotic and laparoscopic surgery to the degree, right? I believe in it. But with that being said, there are some serious reservations that I have, and that's from experience. Number one, when you do laparoscopic myomectomy are synonymous, right? Meaning small incisions, instruments, do everything inside the belly, take things out. Two big problems. Number one, when you do laparoscopic myomectomies, you lose your ability to palpate or to feel, right? The key to fibroid surgery and effective fibroid surgery with retaining the uterus is to remove all of the fibroids. That means that pea-sized fibroid that's stuck in the muscle that you can only get by feeling. If you leave it because you don't see it, which a lot of the times you will not see, it can grow, and that 0.5 centimeter fibroid can turn into a 20 centimeter fibroid. You have to go get it. You can only get that with feeling it. And people say, well, they said on the ultrasound or the MRI I only have 3. Realize no ultrasound MRI that I've seen is actually accurate, right? Because they're going to mention what they see or what they feel like mentioning, right? Any fibroid surgery that I've done, if they say it's 3, it's 18, or it's a whole bunch more. They're not going to mention as many. So don't be fooled and think that you only have the number of fibroids that they say. It's always more. And the small one, pea-sized one, they're not going to mention. Number 2 problem I have with laparoscopic myomectomies is when you perform a myomectomy, meaning you have to cut into the muscle of the uterus to remove a mass, that patient is obligated for C-sections in the future. Now, ACOG has a little haziness where it'll say like that fibroid has to be pushing into the cavity, but there's not a gynecologist on the earth that has seen you have a fibroid surgery that's going to be comfortable with letting you deliver vaginally, right? Especially if you have extensive fibroid disease. So if you have to have a C-section after fibroid surgery, it makes all of the sense in the world to perform a myomectomy open with a low horizontal incision, keeping it minimal, being able to get the uterus out and being able to palpate or feel, get all of the fibroids, putting it back, and then using that exact same incision for your C-sections in the future. It makes all of the sense in the world. And it took me years and years and years of doing laparoscopic robotic myomectomies. I'm like, well, you just can't do it. Yes, I can. I teach this shit. Yes, I do. All right. That's not the reason. It took me years and years and years of doing it and then seeing like how it differs from open surgery to where I was finding these small microfibroids and removing them, and then seeing that none of those
Mm-hmm.
patients came back. No patients that I've ever done an open myomectomy has come back with fibroids in the future, right? I've had patients with laparoscopic myomectomies not necessarily need surgery in the future, but definitely have fibroids come back in the future. So for that reason, those 2 reasons alone, I personally do not endorse laparoscopic myomectomies. People want to argue about it. People want to talk about it like, wow, well, you just don't know. You can argue with me all day long. I promise you, there are not many surgeons in this country that do more fibroid surgeries or extensively deal with fibroids than me. And this is coming out of my mouth, and these are the reasons. So if you have somebody say, oh, well, yeah, you could just do it, ask them why, ask them really what's their experience with it or what have you, and you'll see why they're saying it and what their answers are. They wouldn't argue with the things that I'm saying. They can't argue with the things I'm saying because it's common sense. I believe in practicing evidence-based medicine, right? Things that can be proven through data, as well as common sense medicine, things that make sense. And that's one of Pierre Johnson's common sense things. And that's why I changed the way or my approach or my advice to patients about myomectomies because of those reasons.
All right. If you're just joining, you are more than welcome to send a request to Dr. Johnson to be part of the live. Forgot where we was at.
It's all good.
You got a request?
That's real. Yeah, somebody asked a question. She said, I had a hysteroscopy. The doctor had to stop because of fluid over possibility. That thing, my fibroid was apparently bigger than the ultrasound noted. Would I proceed with her? So the question was that the patient this person that reached out to me was having a hysteroscopic myomectomy, meaning that she had a submucosal fibroid or the fibroid pushing into the cavity of her uterus. They went in with a camera into her uterus and basically started to morcellate that fibroid that's within the uterine cavity. The problem with that is that you also should and need to address the part that's in the muscle. It's very rare that the fibroid is completely within the cavity. It's usually half in, half out. right? Half in the cavity, half in the muscle. So even if you get the part that's in the muscle, get the part that's in the cavity, you need to address the part that's in the muscle. That's number one. Number two, in specifics to your question, when you do hysteroscopic surgery, you basically, when you put the camera into the cavity of the uterus, you infuse water or saline into the cavity, which basically blows things up so that you can actually see, right? If if too much of that water, if there's a fluid deficit, meaning that there's more fluid that goes in than coming out, meaning because there's fluid that goes in and then it suctions out, you have about a 1,000 to 1,500 milliliter window of fluid that you can allow to go into the abdomen safely without having a fluid overload. You can cause like some metabolic shifts or what have you. If you have too much fluid that goes in the belly, you ask how they get in the belly, they go through the fallopian tubes and into the belly. So if you have too much fluid, yes, it is recommended that you abort mission and stop because you don't want to fluid overload the patient. So that is a thing. That's not a bad thing that they were saying. I would not say that that surgeon did anything wrong. They were looking out for your interest. I would say that if they are performing a hysteroscopic myomectomy, that you would ask about, well, what about the portion that's in the muscle of the uterus? What's the plan for that? Because a lot of times that's not addressed. More technologically advanced medicine, gynecologic medicine that we have now, addresses the part that's in the muscle, which is the device that I'm teaching like all over the country. Accessa addresses the part that's in the muscle. So I would ask that question to your doctor. But no, they didn't do anything quack related. Like that can happen. The fluid overload can happen.
What are some side effects after
Go
taking
ahead, somebody.
Lupron?
Menopausal symptoms. So it's like shutting your ovaries down. So hot flashes, vaginal dryness, sometimes bone aches. Like you can have all of the things that are associated with, night sweats, things that are associated um, with menopausal symptoms. Like is what can happen when you take Lupron.
All right. What are some warning signs of reproductive problems?
Um, so infertility is categorized as 12 consecutive months of active attempts of pregnancy, meaning unprotected sex, frequent unprotected sex for 12 months with an attempt for pregnancy and not being successful. If that's happened, um, you have an ICD-9 or ICD-10, excuse me, diagnosis of primary infertility or secondary infertility if you have babies in the past. With that being said, the fecundability ratio, meaning that the amount of time, the percentage of which you could have sex in a month is actually pretty low, right? It's only 20% of the time, 20%, right? So if you just for instance, if you just say I'm gonna have sex randomly, unprotected or whatever, you only have a 20% chance that you'll get pregnant in a given month, right? Which makes sense when you look at ovulation, when you look at ejaculation, how long sperm lives, how long egg lives. You only have 20% chance. So it could be that you're having sex at the wrong time every month, or that you're just not having sex frequent enough at the right times. Like that could be. So before you really diagnose infertility, you want to give like a comprehensive workup, which includes like semen analysis for the male, because 50% of the time it's male factor that's the problem with infertility. We always say, oh, the woman, what's wrong with her? She can't have no baby, she can't get pregnant. 50% of the time it's actually the man that's the problem. So you need to figure that part out first. Then, looking at the woman, looking to see, are there structural problems like fibroids, blocked tubes, like hydrosalpinx, which is blocked tubes, stenotic cervix, things that are impeding the sperm from getting to the egg, right? Or if there is a actual like hormone problem, if she's not ovulating appropriately, if there's an implantation problem, right? So just getting figuring out what the problem is before you go down the in vitro fertilization route and saying there's a problem, just like figuring it out. And a good gynecologist will be able to do that before you have to spend tens of thousands of dollars for figuring out, why you can't have a baby. You should be able to figure that out with just your standard OBGYN. But it's those things. It's also, just figuring out if you're having sex at the right time. It can start there. Ovulation predictor kits, find out when you're ovulating and having frequent sex around the time of ovulation. It may be that simple. A lot of times it's just that simple.
In your late 30s, would it be better to get rid of fibroids and then get pregnant, or get pregnant with them?
If you can get pregnant with them, get pregnant with them. It just really depends on how big they are and where they're located. If they're not pushing into the cavity of the uterus and they're not excessively large, meaning like taking your breath away or causing huge major problems, then go ahead and get pregnant. You're at a race at a certain point, at a race for time, right? The older you get, the less chances that you have. So if you're late 30s, early 40s, and fibroids are not impeding the ability to get pregnant, I would say get pregnant first, have your baby, and then deal with fibroids if you need to after that. So fibroids do not always prevent you from getting pregnant. You just need to really know somebody or have somebody that knows what they're doing to be able to advise you appropriately about it.
Are there any fibroids that you do not remove, or do you always remove all of them?
If I'm in there to get fibroids, I'm getting all of them. I don't leave fibroids behind. I don't care where they're at. They coming out. Like, so if I'm doing a myomectomy to remove your fibroids, I don't leave fibroids. Now, mind you, I have seen hundreds of patients that have reported that they have been with surgeons that have left fibroids because they were by blood supply, or they were just in a bad location, or they weren't comfortable getting whatever. So it happens all the time. Me, Pierre Johnson, fibroid slayer, all that good stuff, I take it all. There's not a fibroid that will ever leave behind knowingly. I don't care where it's at. They got to come out. Because if you don't take it out, it can and probably will get bigger in the future, becoming a problem in the future.
All right. What are ways to prevent UTIs? Leave dirty.
Many different ways. One,
I'm gonna be nice tonight, but be careful who you sleeping with. In a patient's opinion, that's not a medical opinion. In a patient's opinion, be careful who you sleeping with.
That's fair. So one is like drink a lot of water, like hydrate yourself. If you're dehydrated, you're not drinking a lot of water. Yeah, I drink a lot of juice or what have you, a lot of sugar. Like, yeah, you do have an increased risk of urinary tract infection. So overhydrate, drink a lot of water. Number two, urinate after sex, right? Right. So, your urethra literally sits at the top of your vagina. It's right there. So if you're having sex and you're introducing, semen, possibly bacteria, possible all types of stuff people use when they're having sex. We can use our own imagination. But if you're putting those things close to the urethra and then you go to sleep and leave them there, then clearly that bacteria can transcend up the urethra and into your bladder, causing urinary tract infection. So after you finish doing that, please urinate after sex is extremely important. Stay very clean. Don't, if you are, in the summertime and heat, like, stay hygienic, like keep wipes and things, keep things very clean. If you're sitting for long periods of time and bacteria builds up or whatever, it's not a long way the bacteria have to travel up the urethra. The reason why urinary tract infections are way more prevalent in women as opposed to men is because women urethra is literally 2 inches. It's this big. Men's urethra is the length of the penis. So bacteria have a long way to go up the penis to get to the bladder, but bacteria have a very short distance to get to the bladder of women. So you have to be very cognizant of that and be proactive with kind of trying to keep that bacteria from transcending up the urethra to your bladder.
How can patients prepare their body for a myomectomy? Should they try to increase their iron?
Well, yeah, if you are anemic, trying to, maximize your blood count and get your blood levels up as high as you possibly can. Yeah, so if you are anemic, definitely iron supplementation, um, controlling your menstrual cycle, and eating healthy. Like with any surgery, you want to eat healthy, you want to drink plenty of water, you want to be hydrated, you want to, decrease your BMI, your body mass index, right? These things get you healthy and prepared so the body can not only withstand surgery but also heal. Smoking, illicit drugs, all the things that you put in your body that are making you unhealthy. Mind you, your body has to go through something really significant and heal. So if you eliminate those things, you're going to improve your results and your healing from surgery.
All right, another sexual health question. Is a G spot a bump or a bulge or something you can actually feel with touch?
It is. Um, you can feel the area. Some areas are more prominent in certain women, as opposed to other ones. But if you take your finger and you slide it at the top, like so, if the vagina's here, if you slide it at the top of the vagina, past the urethra, like right there in the back of your urethra, probably about maybe half a finger to a finger length, that's where your G spot is at. You'll feel a little knob or bulb there. Not all women have it. Sometimes it's smooth, but that's where your G spot is at. And you can feel it if you press it and you stimulate it. You can. Most women can. I won't say all, but most women can feel it. But that also is advice for anorgasmia, or when women are having issues with orgasms with penetration, to stimulate the G spot in addition to the clitoris. But yeah, in answer to the question, I'm getting off topic, but in answer to the question directly, yes, it is an area, but in some women you can feel it a little bit more prominently than others, just depending on their anatomy.
All right, another sexual health question. If a man hit, huh?
All right, we with the shits. I said they with the shits. No, go ahead.
Yeah, I guess we missed Valentine's Day. If a man hits his penis against the outside of a woman's vagina, does that create a quick rush of blood to the area, making it slightly more sensitive, therefore feeling better when it's penetrated? Uh,
Say it one more
okay.
time. I missed it. I
If
wasn't
a
paying attention.
man,
Say it again.
yeah,
I heard the penis and the
if a
outside of the
man
vagina.
hits his
Go
penis
ahead.
against the outside of a woman's vagina, does that create a quick rush of blood to the area, making it slightly more sensitive, therefore feeling better when it's penetrated? And they said somebody on the internet posted that that's science, and but they basically want to ask somebody who actually studies science if that's even true.
Yeah, you can't. Yes, you can say yes. I would say yes, but a couple of different things. I don't know. I just got immature for a second. You know what I just thought about? Like on Nutty Professor, when he was like the grandma, he was like, "Whoa, might make your head pop out." I was like, "Okay, cool." No, all bullshit aside. No, for real. But like, yes, when there are different erogenous zones that women have, right? Just like, I hear a lot that women will say, well, I'm just not um, a penetration orgasmer. Like they literally have to have all clitoral stimulation. Some women are, you know, straight penetration. They really don't really like clitoral stimulation, or just don't like over clitoral stimulation. Some women are both. Some women definitely have heightened arousal around the introitus, is what you're talking about, which is the opening of the vagina, which is very deep in nerve endings, or very rich in nerve endings, because the clitoral innervation comes through this area as well. It's not only deep with, or abundant with nerve stimulation, but also with blood flow, right? And so when you have an engorgement of blood, right? Blood also heightens nerve senses. So if you are stimulating the introitus, or the external part of the vagina, yes, you are going to heighten sensation, which, like, we all grown here, but like when you, like, just the tip for too long, like, yes, that does start a sensation, because you are not only increasing the blood flow there, but you also are stimulating that rich supply of nerves in that area, which then kind of heightens sex. And it also plays with a mental aspect of, you know, waiting for deep penetration to come, or what have you. So it's mental, it's also physical, but in direct answer to the question, absolutely, because there is a very generous supply of nerves and blood vessels to the introital area, or the opening of the vagina. So yes, that can heighten penetration, make sex sensual, but even mentally do a lot of different things. So it's all tied together, but physiologically, absolutely, with the blood and the nerves.
Okay, so I'm glad that you said that part about the some women are complete like penetration or whatever. So when you did the live with the vagina liberator lady, y'all, I came in late, so I didn't hear the whole conversation. But y'all were, well, somebody said
Hmm.
that some women like their cervix to be tapped. And I think about
Hmm.
when I think about that, I think
Absolutely.
about when I was having children and they checked to see how if you dilated, and that was to me the most uncomfortable feeling. And like I almost didn't have no more kids from that than delivering the baby. Like I feel like that was like extreme violation. Is that the same thing?
S-
Same type of pressure?
Difference. Hold up. Let me. Where are my little models at? I was about to have. I think I put them up. Hold on, so you can see what I'm talking about. Because I'm about
Yeah, you
visuals.
definitely draw a diagram.
So right, right. So what we're talking about is the cervix. So when you come through the vagina, this is the cervix. So this is just looking at it like if you cut somebody in half, but in all actuality, it's like this, right? So if you're talking about the cervix, like when you check the cervix for pregnancy or whatever, you're literally taking your finger and putting it here
I feel
and
like
seeing how far
it was a
dilated it
whole
is.
hand.
1, 2, 3, 4, 5. Right. Like that's how it is. Like you're doing that,
Very.
which is uncomfortable. Whereas with sexual stimulation, a couple of different things. Number one, you don't have all of the shit that you have going on during labor, which you have heightened senses and pain and everything else going on. But two, that's not where the nerves are really concentrated. So the nerves really are concentrated in the posterior fornix of the cervix. So if you kind of wedge the penis underneath the cervix in the back, where the cervix meets the vagina, there's a plexus of nerves that are back there that's very sensual for women too, and just around the cervix too, because the cervix is innervated um, with these nerves. People are like, well, what happens if you take the nerves or take the cervix out? You still have you still have nerves that are in the vagina or whatever, so sexual arousal still will happen. But in particularly behind the cervix, which they don't talk about a lot, but I'll talk about it. Behind the cervix, there's a spot back there which really is a heightened arousal for
So
a
that
lot
would
of
be
women.
like similar to
So
like if
behind it.
somebody was
So
like,
yes.
"Oh,
So
you feel like you're in my guts." Oh,
basically, so if for men, if you feel like a little knob, like you're playing baseball, that's the cervix. For women, if it feels like you feel like it's something being poked on or whatever, it's something's like you feel something that's doing like this, like hitting up against something, it's the cervix. But wedged around the cervix are nerves that are around that are will heighten arousal.
Okay. I'm glad you explained that because I was like, people want to feel that way. Like I was thinking about labor, but if it's the gut
Nah, you think a
feeling, then
whole
that's
different thing.
two totally
Nah,
different things. But I was like, the labor one,
say
it was,
you know about the gut
I
side.
just was like, the other one is complete violation.
You about
Complete violation. I was like, nobody could be talking about that, or I'm just not up to speed on what's going on in 2023. I was like, I don't. That's why I was like, did I join late? So I'm glad you explained that. I get it now. Guts is okay.
no problem.
All right. This one actually is for me. Cola, was your vagina sore after surgery? I watched a previous video and I realized he did not take your fibroids out via the small incisions. Is this why you couldn't have sex? I don't remember being sore vaginally after surgery, but it was like 2 years. It's been like 2 years now. Um, but I feel like the reason why I couldn't have sex is because I'm cut, right? At the top. Or
What? Yeah. So the reason to not have sex like after a hysterectomy is because back to my diagram. So when you perform a hysterectomy, basically you're taking like a cup, like a literally like a cup, and you're putting it into the vagina and it goes around the cervix. And then when you do laparoscopic, you go in through the belly and you're going down, and these are blood supply that goes in here. You're stopping all this blood flow, cauterizing this blood flow, and then when you do that, you're doing this same cup that's coming down from the vagina. You see it from the top, and you cookie cutter around it like it's a cookie cutter, and you cut it around it. And then once you cookie cutter it, then you have a hole at the top of the vagina, and then all of this comes through the vagina, right? And then so when you are done, you pretty much have no cervix, but at the top of the vagina, it's really a hole. It's open. It's just open. So all of that gets sewn up. That takes time to heal. So when you have to sew the top of that hole at the top of the vagina, that takes time to heal. And if you don't allow that to heal, you stick penises up there and try to poke at that hole, then your inside world, your guts and everything else can come to your outside world and come down into your vagina and come out. That you don't want. That's a big problem. So therefore, keep the penises out of your vagina and anything out of the vagina because it's going to poke at that hole. You want to leave that hole alone and let it heal. That's as explicit as I
no.
can get with it.
Oh yeah, the most soreness I do remember is just where my incisions were. I don't really remember. Not saying it wasn't sore. I just don't really like that wasn't the one that would have stood out. So if you worried about that, it didn't stand out to me. You do spot, and some people probably bleed heavy. I only spotted for like 2 days, but I don't remember it being sore. So don't let that make you nervous.
Yeah, it's better from you than me.
Yeah.
I can't comment. You can comment.
Next question.
Oh,
Yeah,
these comments are wild now.
they said, what did I walk in on? Take your phone.
Well,
Sorry, I got to scroll back because I don't have the box. All right, we going to go back to regular health, but it was sexual health on there. I told you we can ask everything. Whatever you want to know, I'm the guinea pig.
you want to come in and listen to this?
You guys talking about?
Something you don't need to be
We
talking about
going
right now.
back to normal
What is it?
conversations.
We'll get to the real stuff.
Scroll.
Yeah,
No, what is this?
No, she cool. I have conversations.
All right.
Okay.
What is the best procedure for treating endometriosis?
Let me put this in the thing. Hand me that. Put this on so she can hear.
I said, what is the best procedure for endometriosis?
The other one. There isn't a best procedure. Every endometriosis patient is different, so you have to treat everybody different. Can
Yeah,
you
I
hear
can
me?
hear you.
All right. So every endometriosis case, go get a chair. You're hanging on. Come
wait,
on,
look.
huh? I see the
It's
retainers.
painted.
Oh,
Go ahead. She just got her braces on, so she geeked up.
There's
Uh,
no chair.
no, go get the
they
stool
look
in the
great.
bathroom. So yeah, it does look great.
That money was great.
Uh, so yeah, right. So as far as endometriosis, hmm, so as far as endometriosis is concerned, it just really depends on how
All you're talking about is
extensive.
endometriosis?
No, we talking. What's up, Money Man? I like she on the radio personalities. Y'all know who she is. We supposed to do something. What happened? Anyway, um, so there are severe forms of endometriosis to where endometriotic lesions can grow into the bowel. They can be very, very extensive. For those patients, they may need surgical intervention. But you always start with
Mhm.
medications first, right? So endometriotic lesions, are fed by hormones. So if you can find a combination of hormone suppressants to control the pain and control the symptoms of endometriosis, you want to start there first before you ever start to operate. Some patients need operation in which you go in and either burn those lesions or strip the peritoneum, which is the lining within the lining
Mhm.
of the belly, right? So the inside of your belly is lined with something called peritoneum. That's where the endometriosis is lodged into, and then so if you strip that peritoneum and then medicate after it, is a way to treat it. Some women have endometriosis that's so horrible that's not responsive to surgery, not responsive to medication, not responsive to anything. And so for that rare woman, then removing the ovaries is the only other recourse that she has. Like you got to
Mhm.
remove the ovaries when it's really, really bad.
All right. So if you just joining, because I see people saying hi, so they may have came late. You still have a chance to send a request if you want to join us in person or join us on the live, and it's almost like you get a free consultation on the spot. Today, I don't have people dropping questions in the chat box because I'm using a different phone, so for some reason the box is not there.
It's another. I got questions here, but somebody just asked like Briscoe's she just asked a very actually good question. It's not a stupid question. As far as can fibroids be confused with endometriosis, and the answer to that is absolutely. Because when patients come and complain about pain, complain about bleeding, um, gynecologists that are not really thinking or not really skilled in it, you could do an ultrasound, see a patient has fibroids, and it's not the cause of her symptoms. You really have to ask like what the symptoms are, what the issues are, understand like with an exam, with history, with all of those things, and putting the picture together, are her problems really caused by fibroids, or is it truly endometriosis? So fibroids can cloud a picture or a diagnosis just by being there, when endometriosis may actually be the problem. So being able to differentiate between the two is extremely important. So yes, it can be confused. I see it confused. I see, like, I had a patient like that I'm thinking about right now that I'm dealing with, that's in another state, that I'm prescribing for medications. Like, she has fibroids, they're really small. She went to several doctors, and they basically told her like she had to have a hysterectomy, she had to have fibroid removal, and she called me because she was frustrated because she was having pain, bleeding. And I looked at her story and looked at her ultrasound and said, this isn't fibroids. Fibroids aren't causing this problem. It's endometriosis. But she's been suffering with this for years. So that's a clear situation in which fibroids can be confused with endometriosis. It happens all the time, actually.
Oh, this is a good one, even though this is people ask this one a lot. Um, what are the
Right.
cause of fibroids? I know you get this one a lot.
All the time. And you'll hear me come up with a lot of different answers for stuff. And
All I can tell you is we don't know, right? I have my own theories about it, but as far as like what can actually be proven, because again, we have people that will talk about stuff, right? About, oh, it's meat. Oh, it's relaxers. Oh, it's what. So what about the patients that don't have perms? What about the patients that never eat meat? Which I've seen both of the two, right? If that's the case, why do white women have fibroids? They don't use relaxers. You know, they're white women vegans. Never had perm, never had relaxers with huge fibroids that I've operated. Okay, so if I have these patients and I'm operating on these patients, your personal theory, not yours, but the theory of this is what causes it has to be wrong, right? Because if you say something, it has to be globally true. So my theory about fibroids, my personal opinion. So again, I preface it by saying what I believe or what I think they're from, which is not proven, which is not anything clinically. It's just me using my common sense and thinking about it, is that there are smooth muscle growths, which we know, but just like any muscle that's overused, you can form calluses or calcifications within that muscle. Just like if you lift with your hands, you have calluses that come on your hands. It just so happens that your uterus, which even if you don't have children, is continuously being used. It's a muscle that's being used. It's being used in menstruation. It's being used when you have children, when you have sex, you have orgasms, you have all types of things of which this muscle is moving. So with that being said, you also have a muscle that's highly responsive to hormones, and it really thrives and lives on hormones. So with those two things, where you have a callus formation or smooth muscle growth of in your uterus, that's also responsive to hormones produced by your ovaries, you can have growths. And now why those growths in some women get astronomical and some don't, then now you have to add genetics, you have to add the environment, you have to add diet, you have to add a bunch of other different things, but they're not the causes. They may exacerbate or make things worse or be the reason why things get bigger or what have you, but they're not the cause. The cause is what I believe is what I'm telling you. But again, there's no scientific data to prove that. It's just me using my common sense to really think about it. But there are extensive tests that have been run on this. We just don't have enough links, and the fact that people say, oh, well, it's perms. But yes, it had the study went like this. They basically studied their randomized trials with women with perms, women without perms, what have you, and they found a statistical difference in which women that have used relaxers have an increased amount of fibroids. But that doesn't mean all of the women that didn't have perms
Right.
didn't have fibroids, right? They have a ton of fibroids too. They just had a statistical, significantly different data point in which the women that had perms or used relaxers had more fibroids. But again, you can't just say that it's caused by fibroid. And somebody will hear that and will be like, perms cause fibroid. Don't do it. It's like, come on, man. It's like you have to really, just like the young woman that sent me these articles today. So I didn't even go into that. So she goes back to my old post and she gets to arguing about things that will shrink fibroids. You can shrink. She's an herbalist, what have you. I'm like, show me the study. Show me the study. If you show me the study, I'll shut up. Show me the randomized control trial where they have this on here. So she goes and but y'all can see it like on one of those posts I was talking about, fibroids or something like that. But she goes in, she puts these articles. Now, like when you put like the replies on the post, you can't hyperlink it.
Mhm.
So she knows that. So you put it on there, you can't click it. So it's like nobody's about to type all of that crazy, all of that whole
Mhm.
stuff. I am, I am, right?
Yep,
So I'm on fact
I
check.
do.
So I went on here and wrote the whole damn thing down, Google searched it, and Google searched the article, read the article, ma'am, and the article is bullshit. Okay. So it's basically giving theories. There's no randomized control trials. It's a meta-analysis about a bunch of unproven data, and it's just a theory about something. So again, for anybody that has something, show me the data in which you have statistical evidence of taking X, whether it be some type of herb supplement or anything or what have you, that's going to effectively treat fibroids. And I don't want to hear about your personal, oh, I took this 30-day cleanse and my fibroid just came up. I don't want to hear that. Show me some data, because that's just, I hear that stuff all the time. It gets on my damn nerves. Go ahead, my bad.
No, it's funny that you mentioned that, though, because I had a law firm solicit me about we are doing a class action lawsuit against the perm providers or whatever, and we reaching out to people that may have either, I think it was either you had a hysterectomy, you had to have fibroid surgery, like it was all different types of procedures, but hysterectomy was one of them. So basically, like I said, they were doing solicitations about the case. So I asked, well, can I talk to somebody about it, because I want to know if the case is based on evidence, or is the case based on you just going to present the best case because you got a lot of people that's signing up saying, yep, this was my issue. And I was like, because if you subpoena my doctor, he's never going to say that's where it came from. I was like, the only thing you'll be able to get from him is medical records. So I want to know what is the basis. So they had some type of rehearsed speech where they were like, well, we're still in a preliminary. So right now we're gathering information. We're comparing case studies to whatever. And then, of course, then they send you like this paperwork, like, well, sign this contract, though, and we'll look and see how effective you are. So me, I'm like you. I'll look up, read, double read, triple read. So I saw 40% split, 60-40. I called back immediately, like, wait a minute. I was the one suffering. Why would you get 40%? I was like, do you know how it is to live with fibroid disease? Like, ain't no way. I said, I thought lawsuits cap at like 33%. Like, where does 40 come from? So in the end, I ended up getting this long letter about how my case probably is not a good candidate. And I was like, yeah, because I got to it wasn't a good candidate because I wasn't going to agree to the terms that was in that contract. Plus, I asked questions because I was like, I need to know a little bit more.
Everybody got something to gain.
Yeah.
So quickly, people send me a couple questions. So this lady said, I had a hysterectomy in 2018. They left the ovaries. It's the last month. My estrogen levels are in the 800s. I've gained weight, fatigue, breast tenderness. What kind of specialist should I see? You should start with an OBGYN. You know, that's 800s is astronomical. I have not seen that. I'm not saying I haven't seen that, but there's some other issue there. So you definitely need a consult with starting with the OBGYN, and if it may need to be escalated to an endocrinologist. But I would start with the OBGYN. Other questions: can you correlate heavy cycle to the location of fibroids or size of fibroids? Absolutely, you can. If fibroids are pushing into the cavity of the uterus, called submucosal fibroids, then yes, they can be exacerbating or making your cycles worse or causing heavier bleeding. So yes, location of fibroids does matter. Size also does matter, because typically the very, very large ones are pushing into the cavity. What is an appropriate amount of time to refrain from sex before a gyno appointment? A month. Real nasty stuff. You know, I've looked down there and like Noah's semen in the vagina on the speculum, was like, man, don't do that. Like, just for a male sanity alone, I don't want to see nobody nut. Like, I really don't. Just to whatever. But you know, just I would say a couple of days. Like, be kind. Like, I definitely don't want to see nobody swimmers. So you don't have to wait a month, but don't have sex in the morning before you go to your GYN. That's just fucking disgusting, but people do it. I saw all those fibroids in a 13-pound. How does all those fibroids fit into anybody? And I would say uncomfortably. She was extremely uncomfortable. Beautiful woman, and she was living uncomfortably, but she was scared. People were telling her she would have to have like this huge vertical incision going all the way up. Like, it was just going to be extensive, a lot of pain. Told her that there was absolutely no way that she could get her uterus preserved. So she lived with it for years, and it got bigger and bigger. But she was miserable. She had shortness of breath. She couldn't move around very well. It was just agonizing for her. So I was very blessed and happy that I could help her. But it is just something that people struggle with that I see, which is why I do these things. But yeah, it was extremely uncomfortable. As you can imagine, holding an 8-pound baby inside of you is horrible. Imagine holding 13 pounds worth of fibroids inside of you. It was horrible for her. I don't know how she was doing, how she managed, but I can understand and empathize, because people are like, why didn't you get that taken care of? Somebody told you they was going to cut you all the way up, right? And you be in the hospital for days on end, and you could never have children, and you never had children. That would be enough for somebody to stay away from the doctor for years. So I don't blame her at all, nor do I judge her.
All right. How are you on time?
They're calling when you're done.
Huh?
She said calling.
What are we doing? We could do a little bit more. How long has this lasted, I guess? Because they're going to cut us off.
It went past an hour. You was late, but it still went past an hour.
All right. I mean, we could do a couple more questions.
All right. Can you develop endometriosis later after childbearing, or is this a condition that usually shows up early in puberty?
It doesn't happen in puberty so much, but definitely early 20s. Typically, if you haven't gotten it by mid 30s, typically not. It's very rare that I see somebody with new onset endometriosis in their mid to late 30s. Can it happen? Anything can happen, but it's unlikely. Somebody want to hop on here? Hold on, let me see.
All right.
If you need my help, I'm easy to find. Just holler at me. Solution for partial hysterectomy. Yeah.
Okay, I gotta figure out how to turn the camera around. Sorry about that.
All right.
Hi, how are you? My name is Janetta. I have a question. I went in and I was concerned about abnormal size of my stomach, and I was concerned I had a hernia. Due to several tests, I did an ultrasound, CAT scan, MRI, and it showed that I did have a hernia along with several fibroids.
Okay.
The general surgeon says the fibroids were like the size of a 9-month-old. Like I was pregnant like a 9-month person.
The general surgeon said that?
Yes.
Okay.
I'm trying to fix the sound. Sorry, now I can hear you. So the GYN said that I was wondering, like, okay, well, can I have surgery, like laparoscopic? And she said no, due to the size of the fibroids, and they will also, before they can remove the fibroids, they will have to correct the hernia. So it would be like she said it would be like a 3-in-1. The first is to do a total hysterectomy, repair the hernia, and then at the bottom, she described it as a apron stomach, cut that and repair that. So I was totally confused, and she told me to get a second opinion, that I could get a second opinion. I'm not in Chicago. I'm following you from Baltimore, Maryland.
Okay.
So she recommended me someone at Johns Hopkins. I just haven't got a follow-up, but I was wondering, like, that's a lot going on. So I got paranoid, and I'm just like, well, I knew I had something going on, because when I did my annual GYN, it's like, hey, can you all look at this? It was protruding where your belly button is. It was sticking out, and I was like, is that like a hernia or something? I said hemorrhoids. I'm sorry, doc. It's a hernia.
Okay.
So I was think my question is that normal to have to go in, have a total hysterectomy and also a abdominal repair at the same time?
Great questions. So if you don't mind, I can ask you a few questions.
Sure.
All right. How old are you?
I'm
Okay.
46.
Are you attempting to preserve your uterus? Are you trying to have children?
Not at all.
Okay. My first question or my first concern would be the general surgeon diagnosing you or saying you have a 9-month size uterus. Where on your belly do you feel it hard? Where? Like, is it at your belly button? Like, where's the soft part and where's the hard part?
The hard part is right around the belly button,
Okay.
but right at the top, she stated that the fibroid is also at the top of my stomach. So
Where do you feel? Where do you feel it at when you go up your belly?
honey, no, I feel it. All my hardness is right around the area of my belly button.
Okay. So when you go above your belly button, is it hard up there or is it soft?
It's soft.
Okay. So your general surgeon doesn't know what he's talking about. All right. It's not a 9-month uterus. It's more like a 5-month uterus. So it's like 20-week gestational size, which is manageable, very manageable. So that's first off. It's not extensive. It's enlarged, but it's not extensive. Number two, in answer to your question, can a hernia be repaired at the same time of a hysterectomy? And absolutely it can be. And they also can be done robotically, right? So there are robotic gynecologic, so a gynecologic surgeon, a skilled gynecologic surgeon along with a skilled general surgeon can work in tandem. And I've done this before with some skilled surgeons to where, the first thing that you would do would be to do the robotic hysterectomy with the small incisions up top and remove the uterus. That will be the first part of your surgery where where the gynecologist will perform. And then the general surgeon will get on the robot and do what's called a ventral hernia repair, because that's what it sounds like you have. So a ventral hernia, ventral just means the top or the front of the abdomen. So depending on how large that hernia is will depend on if you need mesh or how they will repair it. If it's extremely large, then you're probably going to need a synthetic material like mesh to fill that space. But they can also do that robotically. You don't have to be open to do those procedures. You can do those laparoscopically and still be discharged in 1 to 2 days after surgery.
Okay. That sounds great. So what I need to do is just afterwards just contact your office, because I'm familiar with the location in Chicago.
Okay.
And I'll do that. And I wrote down the measurements. Some of the measurements, they were seeming pretty large, like 26.5, 8 by 7, 14. I had like 1, 2, 3, 4, 5 different measurements from the CT scan.
Was it 26.5 millimeters or 26.5 centimeters? Big difference. It should be millimeters.
Okay. It was 26.5 by 12.5. The other one was an 8 by 7 by 5. It was a lot of numbers, Doc.
We'll talk about it. I'll review it. Just reach out to me. I'll definitely review it, and I will, give you my opinion about it. But everything that you're telling me, if it's exactly how you're telling me, then most certainly that could be from a robotic or laparoscopic standpoint. You just have to work in tandem with two. I don't repair hernias, but I do work with general surgeons that are robotically trained that can repair hernias as well.
Thank you so much. Thank you for taking my request.
No problem.
Have a great evening.
Thank you.
Thank you. How would I disconnect?
I got you.
All right. Appreciate it.
That was a good question.
That was. Can fibroids come from abortions?
No, they don't. Do not come from abortion. my contact info. So virtual is this. I'll put it in there.
Yeah, you gotta start pinning your number to the
I'd be so bad with stuff. And then my office number. How you pin this stuff? Pin comment. And then my office number is this. People are like, why can't you do this? All right, let me explain this. Okay. So when you call and people are like, but you don't accept insurance on your website, blah, blah. No, I don't. Okay. I don't accept insurance on my website because if I'm going to talk to you, first of all, I don't like insurance companies. Don't get it twisted. Just because you have insurance, insurances are fraudulent. They don't they will try to pay you pennies on the dollar. None of you guys would do what you do if your reimbursement was 10-15% of whatever it is you were trying to do. You wouldn't do hair and you'd be like, you charge $300 to do somebody hair and they pay you $45 just because. Nobody would be working at McDonald's, right? And they say you'll pay you $13 an hour, and then you be like, you ain't flip burgers right. Well, we're gonna pay you $3. Nobody's gonna do that. In medicine, that's what it is, right? So if I'm going to talk to you at 9 o'clock at night about your whole life and everything about your fibroids, your options and stuff, when you don't, nobody's gonna do that. I'm going to receive something for it. So let's just get that out the window, right? And I've done that. I do philanthropic stuff. I do a lot of philanthropic stuff. That's half of my life. So at some point, I have to get paid for my time. So when you do my consult, like on my website, it's me. It's you and me, and it's a video conversation, right? Which I can do a lot of different stuff. And I can see like that young lady there, I can see where on her belly, I can pretty much do a virtual exam to find out how to map out her surgery and give her the best advice possible. If you call my office, which you can, and my office is going to, accept PPO insurance or whatever, it's going to be on the phone. So you being able to see me, you're going to talk to residents, you're going to talk to a bunch of stuff, which is fine, right? First, you're going to talk to them first, then you'll talk to me, but it's going to be on the phone. It's not going to be as personable, and it's going to be from 9 to 5. You cannot call me in my office, and that's 9 to 5 on Mondays and Fridays. That's it, or really 9 to 3:30 on Mondays to Fridays, and it's going to be on the phone. You want your insurance to pay for it? You are free to do that. It is perfectly fine. If your insurance will cover it, you are free to do that. If your insurance don't cover it, then it's going to be more because I'm working through it with a system. If they don't cover it, it's going to be more to pay out of pocket that way than what I charge like through my consult service through my website. So that's that. I'm not trying to drain people. I'm not trying to do anything. It's reasonable. It's not crazy, but at the same token, I'm literally there an hour going through everything. I don't microwave anybody. I listen to everything. I answer every question. If it takes 45 minutes, an hour, it says 45 minutes on there. I'm literally on the phone with sometimes people an hour and a half talking about everything. I will never, ever stop a conversation or let anybody leave from me without feeling extremely comfortable about what their options are and having all of their questions answered. I am extremely strict about that. And I am very, very dedicated to that, which is also why I get agitated when patients get mad because they were waiting. Because if you're waiting, that means I was spending time with someone else that may have been scared, that may have been nervous, that may have a lot of questions, that may have been in a very vulnerable or bad place. And I had to spend more time with them. And sorry, you have to wait a little bit. And with that being said, when that shit happens to you, and you need more time or what have you than the 15-minute slot that you're allotted, and I'm like, oh, I got to go see another patient, you're going to feel a certain type of way. So realize whatever is happening with someone else, I'm going to give you that same respect and courtesy that's going to be with you. So please, that agitates me too when people are in rooms mad as hell, like I've been in here and such and such. Realize that it's not me twiddling my thumbs, or any doctor for that. Anybody that cares, they're really taking their time out dealing with people on a personable scale. So don't come in there thinking it's going to be Burger King. You get your food and keep moving. I really had to go off on this one patient one time. a couple weeks ago because I had a really, really tough case. This lady had huge fibroids. I had to save her uterus, and she mad because she had to come to her surgeon. She's waiting. How long is this surgery gonna take? Press like pissing off the whole staff. I got anesthesiologist coming into the room. She asking how long is it gonna take. If you want to know the quickest way to piss me off, be inconsiderate to somebody else. That's the quickest way to piss me off. Don't be inconsiderate to people. Realize that it ain't just about you. Like, it's about other folks too, and just have the same respect and the common courtesy to know that if somebody's getting their time and their time is being extended, that same thing is going to happen to you. That's all I ask.
Very excellent point. All right, no other join requests?
No other joint requests, I think. That's it. We covered a lot today. This was pretty dope. What you think?
No, I think it was excellent. And so I'm glad that you mentioned the part about your consultations versus calling your office. And then someone also DM'd me about they caught the tail end of the last live and we mentioned your Cash App or your Zelle. So we are not soliciting donations. This is free game. We voluntarily do this once a month, sometimes twice, to get information out there. He is very sincere about caring about Black women. That is all authentic. We are not posting anything. Number one, he don't have a verified page, so all we need is somebody to pretend they Doc P, and next thing you know, somebody on Dr. Phil like, let me send Doc P money for 8 months. Right. And they just changed one letter in your Cash App and had people sending them all types of money. So, no, we are not doing that. There was a lady that joined that actually asked to donate. So if you are compelled and just want to, I definitely will give you that information, but you come through me. We're not posting anything like that. We're not soliciting that. This is definitely volunteer work. And we agree to do it as long as people need it. And he even give a free consultation if you actually join the live. So this is
on here too. They wanted to hold on.
Okay.
Before they cut us off.
Hi, how are you?
Great. How
Good.
My sister is a nurse practitioner and turned me on to you today. So thank you for taking my request. I'm like the similar lady, except I'm turning 55. Did not know I had fibroids and that I was genetically predisposed. I've gone to 2 Asian doctors, a white doctor, and now I go to the Weinberg Center at Mercy Medical, Dr. Neil Rosenshine.
Gotcha.
And he basically is telling me I can't get a myomectomy and that I need a hysterectomy and they'll leave my ovaries. I don't want a hysterectomy because I don't want my bladder to fall. I don't want to be thrown into menopause early. They had me on hormones for like a couple of years to stop my cycles. My sister turned me on to you and I'm going to start some CMOS. Is it better that I try to reduce the fibroids or go get them reduced or just get a hysterectomy at this point?
How big? Number one, how big are your fibroids?
They said my uterus is the size of a 12-week pregnancy. And they're mostly 3 months. And they're mainly on my left side. So one was like, I want to say maybe 6 or 9 centimeters. Mm-hmm. And some were like 2.3, some were 3.5. They said there's about 6 or 7 of them.
You said that one was 9 centimeters?
I think that's what it was. They tried to say it was 9, and I think the length of it or the width. I mean, I can get that information and fax it to you, and I have no problem with paying. But at this point,
just because you were brave enough to hop on here, you don't have to pay me. So
I don't want to be butchered, if that makes sense.
Gotcha.
And I've been fighting this since 2014.
So let me ask you this. So when you press your belly, do you feel hard? Do you feel for your fibroids?
Only on my left side. My right side, it must be dormant because I don't ovulate from my right. I never have. Mm-hmm. But I know I've been pregnant before, and what happened is they didn't get all the placenta out from 1996.
Okay.
And when I went in May of 2019, The first Asian doctor I went to, she had to go in, look at a camera, and she had to give me a DNC because there was buildup and stuff that had been in there for years.
Hmm.
And then that's when it was discovered that I have fibroids. And so I found that out in May of 2019.
So what are your symptoms right now? Are you having pain? You having bleeding? What are your symptoms?
They gave me a hormone little pill, 10 milligrams to stop my cycle for 2 years. I took that in 2019, 2020, and then Dr. Rosenshine took me off when I went to him about a year ago. So I no longer
Oh,
take it. I spot every now and then, but I cramp.
okay.
And I only cramp on my left side, which when I was pregnant, everything happened on my left side. When my placenta was stuck in me, it was all on my left side. So I know my left side is the side that's carrying all of that burden, if that makes sense.
Are you having like significant pain right now? Are you having like any issue?
I'm I'm cramping, but I don't know if the cramping is from the fibroids or because I went back to working out because I swim. I used to weigh 450 pounds. I'm down to 215.
Congratulations to you. That's awesome.
Awesome.
Thank you.
Um,
And I'm trying to get the rest of this off before I turn the double nickel in June. But I don't want these doctors to butcher me because, like, when I go to community radiology and get my ultrasound, all of the women tell me keep your uterus at all costs. I did want to have kids. I'm okay with that if I don't have kids, but I just don't want to be thrown into menopause if I don't have to be. My grandmother didn't go through menopause till she was 69 years old.
gotcha. So let's talk about a couple of different things. So you raised several different points that I want to address. Number one, first and foremost, this goes for every single person, that if fibroids are not bothering you, then leave them alone. If they're not giving you significant pain, bleeding, infertility, or what have you, if they're not affecting your quality of life, then you don't necessarily have to do anything about them. That's number one.
But the doctor told me he couldn't get the speculum in, and I haven't had sex in 10 years. So I don't know if I can have sex.
Just because you couldn't get a speculum in doesn't mean you have sex. A penis and a speculum, two totally different things.
Okay.
Two totally different things. If somebody stick a speculum inside you, you're going to cringe up. You're going to muscles, everything going to clamp down like you trying to hide gold. Penis, where you are completely in the mood, like it's going to be a totally different feeling. So it's not, don't listen to that. That's hogwash.
Okay.
Second part that concerns me is that you are of menopausal age. So just because you may not necessarily be in menopause, which I would probably argue that you either are.
I'm not. My hormone levels are nowhere near
When,
menopause. They made me take a steroid to stop my period because of the heavy bleeding.
what was your FSH?
I don't have it. I'd have to get him having fax it to me, to be
Oh yeah,
honest.
so I need to see that. I want to see that. Regardless, given this age, I would get an ultrasound and to see what the lining of your uterus looks like. You should not be bleeding at this point. And if that
No, I
lining,
just had a DNC. I've had two
you
of
had
them. I just had my last
awesome.
DNC.
So
Yeah, he's
yeah,
given me two. I had the last one, I think, in
okay,
December, and I went Martin Luther King's birthday for the follow-up.
awesome. So those were benign results.
Yes, he
Okay,
sent out some cartridges or platelets. There's no endometriosis. Everything comes back negative.
perfect. So that rules that out. So the only thing I will be concerned with would be if you'd have like endometrial issues. So if there's a pathology or cancer that's causing you to bleed, which that's been ruled out, perfect. So then from there, the next thing would be about like surgery, if you need surgery or what have you. And the answer to that again is if you're not having significant symptoms or things from your fibroids, you definitely don't need it. If you did, right? Let's say you did need a hysterectomy or you need surgery at your age, not to say that you're old, but if you're not going to utilize your uterus, I would definitely not say you do a myomectomy or anything to preserve your uterus. But the fact that you are not having any issues whatsoever, I wouldn't perform surgery, right? That would be my first question to you. It's like, are you having problems? Are you having issues? Just because you have fibroids does not mean I need to remove your uterus. So you
I
can keep.
wanted to have babies. That was my whole reason for trying to keep it. But the Asian female doctor told me if I got pregnant at my age, my baby would be born retarded and with chromosomes off.
I wouldn't tell anybody that, but Um, I definitely wouldn't tell anybody that. But
It's terrible.
with that with that being said, I have this conversation with every woman that comes to me, is that when you're talking about surgeries to retain your uterus, keep, you know, or versus hysterectomy or whatever, you really have to have a realistic goal about one, if you're trying to have a child, and what your chances of having that child, whether it be from age, whether it be from egg quality, you know, because I have, you know, 35-year-old women that have ovaries that are aged like women that are in the 50s, right? It happens. But you have to really see where you're at. So when you're talking about treatment options, understanding where you're at in the process and what you really want and what your goal is extremely important at the end of the day. But a couple of things that you did say that I wanted to kind of throw out, as far as removing your uterus and bladder falling out or vagina falling out, anything. Hey, Cola, how your vagina and your bladder doing?
I have my
Right,
bladder. I have my uterus. I mean, I don't have my uterus, and I'm not in menopause, so
right. So,
they're not related.
right. So she
I've got a
just
friend that had a full-on hysterectomy. They took everything out, and she's not in menopause either. And they've got her on hormone treatment. So
she has
it's
to be.
just
So what's your definition of menopause?
not having a cycle, the hot flashes, and isn't that where your estrogen levels switch and
So
they
that's
start to
but she
decline?
if she had her if you had a friend that had a hysterectomy and had her ovaries removed, she is in menopause.
Mm,
100%. So that's castration, right? So that's removing your female reproductive organs, and they're no longer producing hormones. She cannot have a high level of estrogen if you remove the source of estrogen. But the misconception is that women in menopause have to have hot flashes, or women in menopause have to have vaginal dryness. That's not true. Women in
that was one of my fears, was my bladder dropping and my money maker drying
no.
up. I was like, oh no.
So
It's like
it does not go
you're
hand
a
in hand where
money maker.
it does not go hand in hand where a woman that goes through menopause has to have menopausal symptoms. I have women that are in their 50s or 60s that are well into menopause, have not had any cycles, are definitely in menopause, and have absolutely no hot flashes, have absolutely no vaginal dryness, but they are 100% in menopause. So the thought that women in menopause have to have all of these problems and symptoms is incorrect. Every woman is different. And if I had 100 patients right now, there would be three categories. One category would be the woman that goes through menopause that experiences no symptoms whatsoever, right? That would be about, I would say, maybe 10% or less. That's a very small subset of patients, but some of them do. 70 to 80% of my patients will have some symptoms, whether it be an occasional hot flash, whether it be occasional night sweat, whether it be, you know, some vaginal dryness that gets better with, you know, lubricants or whatever. Overwhelming majority of my patients that go through menopause have this. It doesn't impact their quality of life to where they can't function. My own mother's went through menopause and was able to function, have the hot flash, moves on by her business, no problems, no need, no medications, perfectly fine. That's an overwhelming majority of patients in menopause. Then you have another small subset of patients, maybe 10 to 15% out of that 100, that have unbearable symptoms, hot flashes, night sweats. They can't function with their kids. They can't do normal day-to-day activities because the menopausal symptoms are so bad. And for those women, they need treatments, they need hormone replacement, but that's, again, a really, 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 really small subset. But from all of those patients, whether you get your ovaries removed or you naturally go, menopause is going to happen no matter what you do. It's happening to every single woman. The question is what your body is going to respond to when you go through it, and that part is completely variable. So for anybody that has to have surgery or has to have a hysterectomy because of extreme fibroid disease or because of any other extenuating circumstance, don't be fearful for things that are not true, right? and you can have a hysterectomy and completely function. You want a doctor that's going to provide you hysterectomy or provide you with that surgery that's going to be minimally invasive, that is going to be able to get it performed without you being down and without you significantly impacting your well-being and your quality of life, which is exactly why I do these with Cola, because I can say this all day long, but I'm a man, and most women say he's a man, he don't understand. That's why I have a woman who I've done this on, to be able to speak more to women, so you guys can ask her, as a woman that is young, vibrant, premenopausal, not in menopause, in her 40s, that has had a hysterectomy, that has, pleasurable sex, that has a, great day-to-day life, that's not having issues, that's not having pain, doesn't have a bladder drop, doesn't have her vagina coming out, doesn't have, turning into a man, is not unclean. All of the things that I hear, I really want you guys to ask her, right? Which is why she's here. I don't have all the answers. I'm not a woman. I just fix the problems. She lives with it. So asking her is like key to dispel some of, these myths and things that as Black women have been passed down and perpetuated, rightfully so, because Black women have been the burden bearers of this country. Modern gynecology has been completely constructed on the backs of Black women, right, that have been brutalized, tortured, and just put through hell on earth, right? For me to even understand surgeries and me to even do these things, it was because of slaves that had been through all of these things. So with all of that being said, women, Black women in particular, have a healthy fear, and a rightfully healthy fear, of having these procedures performed and having the things going on and that have been weaponized to their bodies, right? That have been documented. You have a healthy fear of it. My job, and what I've aimed to do, is to not only explain this stuff, but to alleviate some of that mess and to expose the garbage, expose the BS, expose the bias, expose people that are still doing bad things to women, and offer Black women not only the information, but also the surgeries that you deserve. So I will shut up now. Cool.
Well, no, I watched the movie Henrietta Lacks. I get it. So with regards to, like, they call the seven dwarfs of menopause, I actually, and I hate to say this, I have a master's and I forgot how to spell for 6 months. So I know I'm in menopause.
Mm-hmm.
So then I started taking Colate and Lion's Mane, and it brought my spelling back. It's helped my mind be sharper and things of that nature. And with this, after talking to my sister, who's a nurse practitioner, I ordered some sea moss and some feminine essence, and I ordered me a special type of iron because I was really anemic. I got that corrected. I got my vitamin D levels corrected so I could get these puppy shots for COVID.
Mm-hmm.
But when she just texted me and told me you were live, I joined hoping to get a hold of you because I don't know what to do at this point. I want body lift surgery, but most of my girlfriends have hysterectomies. I did request to be done robotically
Mm-hmm.
because I'm by myself and I'm single and I can't be down 6 weeks. So the doctor agreed to that. I think I got to get an ultrasound and go back in July for them to decide. But I just didn't know if I should get the hysterectomy and the body lift, or just forego the body lift just to keep my uterus. That's where I was at 54.
I mean, plain and simple. If it's not bothering you, if it's not causing issues, leave it alone. And that's that. And from the sounds of it, you're not having extensive bleeding, you're not having extensive pain, you're not trying to get pregnant right now. All of those things are no. Checkbox no. Walk away from it. You don't need a hysterectomy.
Oh my God. Now I can sleep at night. Thank you so much. I went back to swimming and my coach has me doing exercises to raise my pelvic floor. And I think that's what's making me cramp more because I'm swimming 4 nights a week.
Yeah, you are using muscles you ain't using a long time. So yeah, you're gonna have some
So
cramps.
that's why I'm cramping. So it's not my fibroids and my uterus falling out.
No, them fibroids been there a long time. Mama ain't gonna start you to cramping right now. No, that's not it.
Oh my God. Thank you, Jesus. You saved my life. Thank you. And I will call your office tomorrow.
I got you. No problem. Thank you for
Thank
logging on.
you.
All right.
Be
Thank you for
blessed.
joining.
Thank you, Cola.
No problem. All right.
All right. That's a lot, man. I be going because I be you know, when I be reading and just going through, it's just like, you know, and just talking about like what's happened in this country and like just it's just so crazy, and it's just like people don't want to recognize it, and people don't want to, you know, understand,
Now,
like acknowledge what's happened and or do anything about it, and it's really really aggravating. So yeah, I get into my shit.
now, I'm glad you say that because, to be perfectly honest, just the type of person I am, anybody who knows me, my friends will tell you, like, I'm probably the most militant out the group. I don't think that if you wouldn't have talked to me the way you did like that at my visit, I would have did it. Like, I mean, I definitely vibed with you and I definitely trusted you. But when you explained it that way, it was just like it was like somebody talking to me like, you really get me. You know what I mean? Like, you see me.
Yeah,
So it just made it that much more, well, because I was still scared because I tried to lead a day of surgery,
you
but
did.
I was still scared. But I just knew I could trust you because you even thought like the things that I think about, like, you know. So it made a difference. Like I told my friends, like, I'm glad he said that to me because I don't think anybody else would have convinced me or touched the special nerve in me that made me say, oh, he really understands. Like he know his history because I'm the historian of the
Right.
group.
Yeah,
Yeah.
you'd have kept that to now. We'd have had a whole different conversation.
You
That
know
shit was ready.
what?
He was
You
ready to
just ain't
pop.
gonna never let me rest. Well, and I'm still talking other patients off the ledge too because people be in my DMs and they be nervous and I be like, no, you're brave, you're this or whatever. So he's right. Please reach out if you don't want to come to the sessions and you don't want your name on the screen. I definitely answer questions all the time. And that's why I say you're needed because you don't even know some of the stuff that go on behind the scenes. And some people I don't even know they're your patient until they tell me. So
Yeah, and they talk to you well before they talk to me. So that's all good with me. Y'all talk to me. It's cool. If y'all need to talk to a woman and be like, is he all right? Is he cool? Talk to him. That's what I tell y'all. When y'all do research on your surgeons and your people, like they should be completely transparent. Like I don't have a problem with you talking to any patient that I've taken care of to see what type of person I am, to see what type of care I give. I encourage it actually. Like I want you to. Whereas hold up.
and I am not his only
Not
patient. It's just the simple fact that it's very hard sometimes for people to share that vulnerable side. And I agreed to do it because I would like what he said. I would want somebody to show that consideration to me. So I was willing to be sacrificial in my vulnerability.
So becoming a butterfly 22 is like she is the patient that I'm currently doing right now. She's the patient. If you look at my post, she's had her surgery, so I'm gonna post her like what her surgery looked like and what she like. Again, she had her case was even more difficult than yours, Cola. Like it was nuts.
I keep
Um,
telling you, it's people worse than me. You just be always
yeah,
on me. I'm telling you.
hers
That's why I
was.
said
Hers
you
was.
done
That's
let
why I
the
posted it.
GDs in the door.
That's what her hers was. I will give it to her because I even because I got into yours and I was like, man, what the fuck are you doing, man? Like you tripping. And then, but I was like, all right, got through that one, cool. And I got into hers. I'm like, dog, you really tripping, bro. Like this is like I don't let it go to everybody like such and such. But if they know what's going on in my mind, I'm sitting there thinking myself like, how are you really gonna do this? Because you know my once I put the ports in and I sit at the console, it's getting done. I'm not getting
Hmm.
it's going to happen. So when I start just like chiseling away through this big ass fibroid, like I'm just like, damn, what your life about, dude? You tripping. But it worked out.
And you ain't
Oh
even scratching up butts no more.
yeah. Well, you ain't gonna
you
let
did,
that butt thing
you
go, boy. You
practiced
have to
on
hold on
me.
to that
You practiced on me.
butt.
Now I always got to tease you about that one because we was like, how did that happen?
So yeah, I got patients all in here feeling myself daily. Like she's a patient, she just had her surgery or whatever. So it's like it's patients in here, like for real. Like if y'all, if you have surgeries with me, like it's women in here that are looking at this. There's people in here that got mamas, sisters, aunties, or whatever, and are looking at this for answers or what have you. Like it's okay to just like kind of make yourself be known as like I had surgery or what have you. It's not for me. It's for people that actually see it, and people will reach out to you just to see how I am or to ask questions or whatever. You help a lot of people by doing that. So I encourage that. That's what these things are for. We should be a community. I mean, that's the only way we eradicate, these healthcare disparities. One, with transparency from doctors that give a damn. And then two, as a community, trusting each other, and then like putting this information out so that we can take better care of ourselves and demand that people take better care of us. And if they don't, push, the community that we have to elevate the level of care for us. So that's how it's done.
Yeah. And if you want to know how to contact me, I'm Cola Red Bell on almost every single social media site that I am on. My name is consistent. So, and Doc P taught me Instagram, and I got teenagers that teach me too. I came a long way. I came a long way. So I know how to check my messages, and if you're not my friend, I know how to go in that box too, and I move it around or whatever. So please feel free to message me. I do work a full-time day job and a part-time evening job, so I get back to you. Give me a couple days, though. Give me a couple days, but I get back to people.
I got 3-4 jobs, man. I got jobs.
I'm like a American.
I try to get back to y'all, like, but man, look. I don't ignore anybody. I try to answer all questions or what have you. Realize I got so much shit going on. Like it's amazing. I amaze myself sometimes at like some of the stuff. People that are close to me, like my family that actually sees the stuff that I do, like it's insane. So if I don't get back to you right away or whatever, it's not on purpose. Like I literally have 3 jobs right now, that I do, and I really need to chill out. But again, I have a mission and passion right now. While I got energy, I got breath in my lungs, I'm gonna do it until I'm ready to chill out.
That's how I feel. I do work hard now, so when I retire in Jamaica and you said you got doctors down there, then I will be fine and free. Because I want to retire somewhere where I'm not the minority.
Oh yeah, I'm trying to work with my Jamaican connect, like, so they can get me on down there so I can,
that's where I want to retire for real. That's where I want to go.
All right, people.
All right, well, Doc P, I appreciate you. We did overtime, double time this week. Be safe this weekend. You said what?
We ain't even get cut off. That's pretty dope. They might give me a blue check one of these days, possibly. So I don't.
We gonna work on that blue check for you. But that's why I said, like, I'm not gonna post this information because it'll be one person. You done already got catfish, scam, page taken over. Like, it'll be somebody solicited.
I only got 18,000 followers. It's like, damn, why me? Like, it's like people got all type of stuff out here, man. They coming to get me.
I would like to live on the main island, the Montego Bay Island, personally, when I retire down there. I don't know which town just yet, though. I'm still investigating that. But I'm going to be on one of them House Hunters International. You watch. But, yeah, thanks, Doc P. And we will do this again.
Absolutely.
And I always, he's going to save it, and I'm going to post it to YouTube. So share with someone who doesn't have social media, and definitely share this stuff. Take sound bites of it. Screen record your favorite part. Please share the information, because what we got to do is always take care of our own and others.
Absolutely. So y'all, I'm gonna post this on my page. Y'all can watch it again. You can also see the people that are in here that's commenting, that's had surgery. Cola's had surgery, obviously. Like, reach out to them, ask questions. Like, they are huge resources. I not only operate on my patients, but I educate on my patients. I educate them all. So they are very, very excellent resources, and even better than me because they're living with the results of surgery or what have you. So very excellent resources to talk to. So go back, scroll through, and see who's been operating on, and reach out to them. Everybody's cool. All right. God bless y'all. Have a good night. Thank y'all for tuning in. This was dope. Share this. I'll talk to y'all. We'll talk to you in a couple weeks. Cole?
Yeah, well, I know you said that your schedule where you get back is tight, so we'll figure it out. We definitely always do once a month, but when we can double up, we'll do it. We have no problem with that.
Y'all send y'all questions to it, and the questions they start booking up with questions, and we'll do it sooner.
Yep. Absolutely.
All right,
All
y'all.
right. Take it easy.
All right.
Thanks. Peace. All right. Bye.